Hello and welcome to our health visitor interview, and the health visitor is a professional who Home Start Portsmouth works with very closely, and all health visitors in the city are qualified either midwives or nurses, and they have all done an additional public health qualification so that they are able to assess children, support families and help children achieve their best outcomes for the under fives. So I'd like to introduce Linda Lishman to you, and she is a health visitor in Portsmouth and she works in the central team. Portsmouth's divided into 3 parts, and Linda works in the middle part, central, and you're based at the civic offices, Linda, aren't you?
Yeah.
So if you'd like to tell us more about yourself.
Yeah, that's right. My name's Linda Lishman. As Jay says, I'm currently working as a health visitor in the central team. My background is I was a midwife, and I've been qualified health visitor now for 2 years.
So we all want the same thing, Home Start Portsmouth and health visiting. We want children to be the best that they possibly can, and we support parents to help their children achieve that goal. So Linda, would you like to tell us some more about what you consider it looks like for a child, good child development, what that looks like and how your service supports that?
Yeah, so I think that the most important things for children to help them achieve their best potential is a real stable upbringing right from the word go, even when they're developing in their mother's womb. So attachment is really, really important. We know that maternal mental health is crucial for this, a good maternal mental health, and good parenting ability. So we really want to support parents to be the best they can to parent their children as effectively as they can, to just ensure that child is given every opportunity to be their best. And in addition with that, all the time we're constantly safeguarding those children, so constantly looking out for any safeguarding concerns.
So tell us a little bit about what you offer as a service, when you start, because I know you start before baby's even born, and what you offer as the child grows and reaches different milestones.
Okay, so as a health visiting service, all children who are born are open to the health visiting service. And really, the input that a family gets from health visiting is really dependent on their need as a family. So there are different levels of support that we can give families, but all families who have children will receive 5 mandatory contacts. So that's antenatally, a new birth contact, a contact at 6 to 8 weeks, and a 1 year and a 2 year development review. But we're also able to offer additional support in areas such as behaviour, sleep, nutrition, toileting, all of those things that kind of crop up. So our service is very flexible, and we work alongside other professionals in our team. So we have community health nurses that work with us, we have infant feeding specialists, we have specialists in areas such as behaviour, sleep, toileting, that we can refer on to. So we all work together as a team. And really, as I said, it depends on that family's need. But crucially for health visitors, we are more so now directed to the more vulnerable families within Portsmouth. So we are working more closely with other professionals, other partner agencies to really help safeguard those children.
And I know that from our work together that you also, it's not just parents, is it? You would support grandparents, aunties, uncles, whoever is caring for a child.
Yeah, absolutely. We see lots of families that are in non-typical circumstances and situations. So whoever it is that's involved in that child's care, we will support, absolutely.
So we've sort of touched on how you work alongside the people in your team,
Yeah.
community health nurses, but you also obviously have a close relationship with GPs,
Yeah.
other medical professionals, school nurses who support
absolutely.
children who are older, of school age,
Yeah.
and also social workers. So tell us a little bit about your role working with the other professionals in the network.
You're right. So we work very closely with lots of other professionals. We contact, some of us use the same database system, so we can communicate through that, which is really, really helpful. For example, if a GP had a concern, they could task us directly, and then we would pick that up very, very quickly. More and more we're working alongside social care, far more closely, I think, than we ever have done in the past. We do actually work in the same office, so that's really handy, that's really useful for close communication. You can just sort of go and have a chat, or, we use a lot of technology. So
you're based in the same teams, aren't you? With social workers and other professionals, aren't you?
Absolutely. So they're all aligned. So we have there's two central social care teams. So you kind of get to know the social workers, and you're often working with one or more families with the same social worker. So it is just kind of a really fluid conversation. We're starting to use technology a lot more, so we might use Zoom or Microsoft Teams to be able to have those conversations as well. So it's getting a lot more interactive, I would say.
Yeah, and that often provides better outcomes for children, isn't it? That's
Definitely.
why you're set up that way,
to
improve the communication between professionals.
Yeah, absolutely, because the other thing is that we don't want the parents to have to keep repeating their story over and over again. So, that's really important for us all to be able to know these circumstances. The parents don't have to repeat their situation all over again, and we all know exactly what our responsibilities are in terms of care of that child.
So tell me, in terms of your work, what's a typical family that you would refer? Why would you refer to Home Start?
So I think there's a few criteria that we would look at. I think often we're looking at, how well is that parent supported? Do they have a support network? Do they have the knowledge and the skills to be able to parent their children effectively? And it might be that they don't, it might be that they've never been shown that themselves. It might be that there's some mental health issues for that family which prevents them from putting their child's needs first. So we as health visitors, we can see families fairly often, but actually what some families need is that one person they can really build a strong relationship with, and they can see them consistently, which is where Home Start comes in, which is fantastic for us to be able to work alongside, because we know that you as volunteers will be able to go in and support us in addressing those issues the families have.
Because we run a number of services at Home Start, and we're really closely aligned, particularly to one of our services, and it's only health visitors that refer to that one. But you also refer to our school readiness programme and our parenting support programme. So you can refer in any service, but it's the 0 to 5 home visiting service that's aligned with your ECHO programme, isn't it? That
it is.
All our referrals only come from health visitors for that.
Okay.
So would you mind telling us, obviously no names, a typical family that you've referred that you can remember, and tell us a little bit about that family? Yeah,
definitely. So I had a family allocated to me following on from a paramedics report that had raised concern about the home conditions. They had been called to the family home because there'd been a small fire and the mum had an asthma attack. When they went to the property, she has 2 little boys. One was of school age, one was 3 at the time, and the home conditions were appalling, I think was the word they used. And this wasn't the first time. We had then a couple of other reports come in for the same thing. So I visited, and then very quickly found out from our conversations with mum that actually the little boy wasn't in nursery. The older school child had sporadic attendance at school. There was some domestic abuse present in her current relationship at the time. And so there was lots of things going on for this family, and I also noticed that Mum really wasn't, she didn't really know how to manage her children's behaviour very well. So I quickly identified that there were quite a few issues going on for this mum. She didn't really have a good support network at all. So it's about thinking that eventually, unfortunately, this mum did go into social care under a period of sin planning, and that's when we got Home Start involved. So she had a volunteer assigned to her.
And what were the indicators that the Home Start intervention had been successful, alongside all the other professionals that were involved at the time?
Yeah, so I think one of the main indicators was that the police incident reports stopped coming in.
Yeah.
I could see an improvement when I was visiting, so I was visiting her quite often as well. She was under our early help programme, and I could see that a change was being made. She was getting out and about more. The 3-year-old was had a nursery place, so I could just think that things were improving. She was starting to make better choices about her relationships, and her whole narrative was changing. And I think that she just needed that, just that input of people to sort of give her the knowledge, actually, that she needed, to be able to not only help herself, but to help her children.
I often say that Home Start volunteers are change supporters, because the families need to initiate the change, but we can be there each week supporting them to achieve the changes that they need to make.
Absolutely, and that's what the whole service is about. I think it's not about us going in and doing things for people. It's not about us making those changes. It's completely about us supporting and empowering those parents to make the changes that they feel would benefit their family.
One final question. Thank you for that. If you had one piece of advice for a volunteer, what would it be?
Ooh. Don't feel that you're alone. You know, we learn things all the time, so I would say know that you're a very special breed, because what you're doing is fantastic for us, for the families, for those children, most importantly. But seek your supervision. If you're not sure, ask questions, and enjoy what you're doing, because it's such a worthwhile thing that you're doing.
Thank you.
You're welcome.